Welcome to the office.
Hi.
Hello.
Welcome.
Thank you, sir.
Nice to meet you.
Same here.
So, where are you coming from?
I'm coming from Dallas, Texas.
What you coming all the way from Dallas, Texas here for?
I'm suffering from pain from almost 4 to 5 years, I would say. And I tried 5 different
Hold
chiropractors.
on, when you say 4 or 5 years, what are you dealing with?
Dealing with my neck pain, lower back pain, my knee pain.
Okay. Everything right-sided?
Yes.
Mostly right-sided?
That's
okay.
correct.
And what's number one for you?
For me, it's lower back.
Lower back is number one.
Yes.
But that's been going on more than 4 or 5 years.
Yes, that is correct.
That's been going on for a while.
Yeah.
Okay. You had a trauma, an injury, you remember?
No, nothing.
You sure?
Yeah.
Because I'm going to show you a bunch of stuff there that I see.
Okay.
There's nothing you remember, no slips, no falls, no tailbone injuries. No. You grew up in India?
Yeah.
Bicycles, walking,
yeah, I don't
playing?
Remember
no?
that.
Okay. Well, as I show you the stuff, maybe you remember it down the road. It doesn't matter. I just show you what I see anyway. Okay. So number one is the back, low back pain.
Lower back pain.
You wake up with it every morning?
Yes, I wake up with early morning with that pain, like mornings, especially from 6 a.m. to 8 a.m. I cannot even move.
Stiff.
Totally.
Stiff. And then after a little bit, you get moving. You work from home?
Yes, I work 100% remote.
Okay, so you work remotely, so you have that.
And my workload is like I have to in front of the computer over 8-10 hours per day.
Correct. So one of the things we're going to have to figure out with you is not just what's out, but we have some habit changes that we're going to need to do. I see a lot of people on the computer.
Right.
And we don't change those habits, nothing is going to change, okay? Right. Please. All right, so number one is the back. Any shooting pain down your leg? Left or right?
Right.
Only right?
Only right.
Does it go into your toes or stops at your ankle?
No, just a knee.
To the knee, okay. So when someone tells us we got that pain traveling down the leg, it stops at the knee. Usually that's a pelvis issue, usually. Okay. Now obviously it's what we find on you. When they say it goes down into the toes, that's more of the sciatica type pattern. Okay. But we'll see what we find on there. So right side goes to the knee, the outside, the inside? Inside. On the inside here?
This way.
On the
other side.
On the
outside.
Lateral side deep?
Yes, that's
got it. And you had an injury, you said, 5 years ago?
No.
So what happened?
I mean, so what happened after, I have 2 kids and both are normal deliveries. So I was under impression that, because of I took the epidural and that's creating the pain, especially during the winter. But that's not the case. Like after my second delivery also, the pain is always on and off. Okay. No matter what. So either I go for exercise on regular basis or walk or something, it not change.
Okay, all right. That's the back going into the knee. You said also the neck, number 2?
Yes.
Number 2?
Yes, number 2 is neck.
That started 4 or 5 years ago. Okay, and that you started, was there an injury or just started developing over time slowly?
Over time slowly by continuous.
Before COVID, after COVID?
No, before COVID.
Before, yeah. So it wasn't, you were working from home before COVID?
Yeah, from last 10 years I'm working 100% remote.
Okay, I got it. Yeah. And one thing we're going to talk about later is also your ergonomics, your station at home, and we're going to have to make some slight changes.
Okay, sure.
Okay, what else?
That's all about.
Okay, well that's a lot. You ready to get started?
Yes.
Let's go over your x-rays. This is you. This is a picture in time. Tells me how you've evolved from birth. We have 24 bones in the spine that move, 23 discs in between. I want you to think of this as your 24-story building. In order to have a stable building, we need to have a level base and foundation. And the first question is, do we have a level base and foundation? No, we don't.
It's not.
And we need to talk about why. We'll come back to this in just a second. This x-ray, we're looking at 3 main things. Number 1, do we have the right curves in our spine on the side? Do we have the right posture? And what are the shape of the discs? So the first thing is, we have a reverse curve happening in the neck. This needs to go forward 40 to 60 degrees, 60-degree curve in the mid-back, 60-degree curve in the low back. So the first thing we see is there's a little less curve in your spine. And I'm going to talk about where what we need to do to get more curvature in your spine. So one is the curves. Number two is posture. When we're looking at posture, we're running a posture line straight up. And in your case, what we're going to have a little bit of that anterior head carriage, okay? So from neutral, your neck is more in a forward position. For every degree past neutral, times 10 is what the lower cervical spine feels. So if we're modest 10 degrees, 12 degrees forward times 10, it's like you carry 120 pounds on your shoulders. Yeah. So when you sit for half hour, you're already feeling that tension, right? Mm-hmm. Yeah. And the idea is going to be to help get your curve back and figure out what we need to do for your posture, okay? Now, before I get into the foundation there, I just want to take a look at your tailbone here. So the good news overall, I don't see a lot of, this should be a smooth curve going through here, right? Okay. Overall, I don't see any big nubs here. Mm-hmm. So that's the good news. Now, let's go over to this side and let's talk about this foundation, what's really going on here. So we see the level base and foundation. First thing is we have a shorter lowered leg on the right side, 11 millimeter measured difference. This needs to be under 7. Follow my process, ma'am. Okay. It needs to be under 7 for these adjustments to hold. Now here's what I want to show you. 4 of the 11 is actually coming from your pelvic misalignment. Your right side goes down, your left side goes up and in. Mm-hmm. Now follow this. The tailbone goes back 3, but look, it's down 8 millimeters on that right side. Right. That's a tailbone injury. Oh. But because I don't see a lot of nubs there, that's an old tailbone injury. Now follow, please. So it goes back 3, down 8, up, in, and then the whole thing goes down. That's your imbalance. So whatever's happening in your knee is all secondary anyway. Mm-hmm. I'll show you a couple of things on the X-ray, sure. But knee doesn't even, because remember, the knee is formed by the tibia and the femur. Yeah. The femur connects inside into the socket here. Mm-hmm. So the hips are still good, but the alignment is throwing off the angle of the femur, which is throwing off the angle of the knee. Okay. Does that make sense? Yes. So let's go a little deeper and look at your tailbone here. So when I'm looking at the tailbone, I'm trying to figure out this part here because there's an 8 millimeter difference there, and I'm trying to figure out, So you see here, this is L5 here. This is the transverse. There, the lever, and there's a nice space in there. There's no space in here, it's scar tissue. So what's happened with this imbalance over the years is that your right L5 and your hip, your stiffness is a lot on that right side, I agree. Deco. There's a space here. Right. There's a space here. Here, yours has no space. Here, it's all scar tissue. And so it's all stiff from whatever happened, but there was injury for sure. Okay. There was old injuries for sure. So the body has compensated over the years. Now, if I take a line here, I'm going to take a line S5 Coccyx there. Watch this. You see that line there? Yes. Okay, watch this. So let's make that line parallel. Is that a... Right? Yeah. Your short leg came from an old tailbone injury. Now, if I look here, that matches. Yeah. So the whole tailbone is we got to bring that up on that side. Okay? Now, if we're trying to get more curve in your spine, then the ASI and ilium is what causes less curvature in the spine. The other thing that's throwing me off is this. Your sacral rotation is to the left, but your vertebrae are rotated on the right here. You see that?
Mm-hmm.
You ain't telling me something, lady. I don't know what it is. You see what I'm showing you, right?
Yeah, yeah.
It's rotated left, but so these bones should rotate with it. So whatever happened separate here from down here. I'm assuming you were a very active kid?
Oh, yeah.
Very active.
I was.
Very active. That makes more sense. Now, there's a finding I see on the X-ray you may have heard me talk about. Your husband, I'm sure if he's a big fan, has seen it. You have little calcification at the ends of the ribs here.
Yeah.
Whenever I see that, I always tell the patient to get their thyroid checked. 80-90% of the time there's...
Yeah, I did that, and I'm negative.
Why don't you send me the blood work? I look
Sure,
at it a little
sure.
different, okay?
Absolutely.
So this is all. So now all of this is compensation, 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 and yeah, dude. T1, T2, T3 side slip. Okay, digestion. Let's talk about your digestion. This is your Megan Blasi. This gastric air bubble is fantastic shape. All that's good. Could be a little bigger, but overall is good. There's a little bit of undigested food going through the colon. You're gonna let me. You're here for how many days? A few days?
What's that?
You're here for a few days. You're here for the week, right? Okay. So you're gonna tell me if any changes happen in your digestion. Veg, non-veg?
Veg.
Perfect.
Pure veg.
Okay. No problem. All right, you ready on the, let's go back here now. Let's look at your discs. Overall, the discs are good, ma'am, okay?
Okay.
Over in the low back. But because of the curves, you see those circles?
The curve is too deep. That's what I feel normally.
What are you talking about?
The lower back curve?
It's not deep enough, ma'am. There's no curve. You have a sway back, not a curve.
Okay.
So you can see if I just do this, look. If I just do that, there's no curve. That's not a curve.
Okay.
But what you're feeling is, because the thing is tilting back, right here, you can see it looks like more curve. It's compensating. It's not more curve. You actually need more curve.
Okay.
So we'll see how you do with 1 or 2 adjustments, and then we'll figure out from there. These discs are all good. Now, this is the other issue here. There's an old C5 injury, okay? 2, 3, 4, you see C5 there? 6 is also back, 7 is also back. It's starting at 7, but I may have to work on 5 as well. 7 goes back, it's hitting in the back of 7 on the back here, and then we have that reverse curve starting. So that's about 18 years ago, 15 years ago, whatever happened in your neck. All right? I'm just letting you know.
I have a big bump over here.
Sure.
What it could be because of that?
The Dowger's hump is caused by a lower thoracic spine. It's caused by dishing coming from 7.
Oh.
And I have a video on it on Instagram. I talk about where it comes. I explain it in detail. So the hump is not a hump. The hump is bad posture. All right, you ready to get started?
Yes.
Chalo, have a seat on the chair in the center, please.
And one more thing, just for the information, that my sugar is always at border.
Yeah.
No matter either I take intake of sugar or not, but it always comes at the border.
Got it.
So doctor said you are a diabetic now. During my both delivery, I was a gestational diabetic.
Starting at the base of the neck. You had gestational diabetes during pregnancy, right?
Yeah.
And right now you're borderline what? HbA1c is at what? You're talking about your sugar or your HbA1c?
Sugar.
That's not a proper indicator. You need to look at your HbA1c, which is your sugar long term.
Okay.
So to just do it based off of a glucose test is not accurate. And if you get the blood work for me, I can explain it to you. Well, I got the sugar button, T7. Yeah. 10 points. T7, T6, T7. That's your digestion. You're probably what we call dysinsulinism, which is pre-diabetic. And that comes from, I talk a lot about it in my older videos, it comes from bad digestion. You're not absorbing and assimilating your nutrients as well as you could. And that's a very simple way to change. Oh boy. What's your husband's name?
Amit Gandhi.
Amit. She gonna get it. S5 down low. All right. That's the tailbone. Ajo. Come back slowly in extension. 5. Pain. 1. Pain. 2. Yes. 3. 4. Nobody checked this for you?
No.
5. Madam! Watch your tongue. No potty mouth here. Family channel.
Yes.
Maza. All right, come over here. We do static palpation. Running my fingers down the spine, static. We're looking for swelling, edema, point tenderness. You can see the swelling edema right there. That's 7. 2, 3, 4, 5, 6. 7. Right side. Left more or right more?
Right.
People that have been watching a long time, they know when I get T7, I said, that's the sugar button. So S5, T7. Let's check the hips. Feet scoot forward, please. Open the knees, close the knees. Open, close. Open, close. Right side only, please. Right knee only. Open and close. When she does the right, the left goes with it. Left side only. The right side is fine. This is the left SI joint. S5 coccyx, left hip, T7. Sit back for me, please. Sat. Che. Sat. Okay. Stand up for me, please. Look at the dimples. They should do this. Walk, please. Walk to the corner. The dimple don't want to move up and down like this. Keep going. So the left dimple moves up, but not down. That's the stuck. It's stuck up. So we're going to bring it down. One more time, please, and we'll get started. So guys, just watch the before and after. Have a seat, please. So here's our game plan for today, okay, madam?
Okay.
The game plan for today, we're going to do Coccyx S5 on the side. We're going to start to bring that right hip up today.
Okay.
Then after that, we're going to go on the Hylo table. We're going to go more of the tailbone, and then we're going to do T7. After that, we're going to come back and do your pelvis.
Okay.
I got a few days only with you, right? You're here till Friday, Saturday?
No, Saturday.
Okay, so we have the week.
Yeah, we have
no problem. No problem. Okay, ready?
Yes.
Ajo. I'm down low. And we got to bring that side up. Let it roll, please. I got you the whole way. Let it roll. Up. Gotcha. Hi. Come on up. Okay, slide up a little more, please. There you go. Hands, shoulders down, down. All right. We're down low. We want to get a little bit more torque up. I'll use the drop board. This way. This way. Relax the shoulders, ma'am, please. Thank you. Ow! That's the home run. Ho gaya. I had to, madam. 5, 4, 3, bus. That's the worst of it, okay? Relax, please. Relax, relax, relax. I didn't say it was over. I said it was the worst of it. Sat. Bus. Bus. Ho gaya. Your husband likes you, right?
No
Maza karte maza. Come off slowly, please, but check it out. Hold my hand.
Okay.
Walk. Check it out. Walk 3 times back and forth. As you're walking, tell me what feels different to you.
Yeah.
Mm-hmm.
Yes.
What? Yes.
Feels different and feels good.
Good. Shukr. One more time, please. Walk. You didn't know what to expect, did you? Come sit. Good. Shukr.
Okay.
Aja. Sat. Relax the neck there. This one's light. Light. Chordo. Chordo. Let it go. Come on. No, I'm not even done anything yet. You're fighting it. Stop. Right ear down. You're fighting me. Come over here. Ajo! I try to be nice. So in her scenario, I'm doing the prone adjustment. Slide up, please, ma'am. Up. I'm doing the prone adjustment. Up a little more, please. Bas. Relax the head here. She's fighting it. She does have some hypermobility in the upper neck, and when I'm trying to isolate the lower cervical spine, she's just too tense. So I can't get her to relax there. In the prone position, we're following the mechanics of the joint still, and we're just going to set bus. Oh yeah. So she fought, but she can't fight as hard. Right, madam? Walk it out. Awesome. Come have a seat over here, please. Now, let's re-scope and check.
So the gas issue is also because of this misalignment.
The gas is there because you're not absorbing, assimilating, and you don't have enough HCl.
Oh, okay.
So we're looking at it 2 ways, neurologically, and we're looking at it nutritionally. Okay. Guess what? Neck is all clear, ma'am. Okay. Look straight ahead. 7 is clear, ma'am. Oh, Madam Ji. Tailbone is clear. Sit up straight. This is where I'm going to get you before you leave. Come back. I want you to feel this. Come back. Don't be scared. Look. I didn't touch it. Yeah. Ick. Different, right?
Yeah.
5, 1, 2, maybe a little tight. Different?
Yes.
4. You remember?
Yeah.
5. Amazing. Pretty cool. Shall I continue? Shoulder. Shoulder. Ears.
Oh!
On your back, please. Piche, piche. Your mom used to do that? Daddy used to do it, or who?
Mummy.
Well, mommy used to do it, right? So I didn't hurt her. She just had a flashback. Ankle. Cool. Sit up and turn. Awesome. Now, madam, buff and polish.
Okay.
Vibration therapy breaks up scar tissue. When it goes over normal tissue, it does nothing, just buzz. When it goes over the scar tissue, you feel that tickly spice. Walk last time, please. And today is your day 1.
Yes, that is correct.
Now, last walk a couple of times. As you're walking, a little lighter.
Yes.
Sit on the floor. I want you to say something. However you sit, doesn't matter. Now you want to see the cool test? Get up fast. It should be easy.
It's better.
Easy.
Easy, yeah.
Cool.
Thank you so
Squeeze. Come here. Squeeze. Squeeze. Relax.
Ow!
Hi. Bhul gaya?
No, how can I?
Squeeze. छोड़ दो. Elbow.
Whew.
Bas. Squeeze. Questions for today?
No, not at all.
Welcome to the office.
Thank you so much.
Nice to meet you.